Welcome to the Sheila C Hill Show. And that C stands for come on in this room and have a sit down so we can chit chat just for a little while. Listen, the Sheila C Hill Show is the ultimate go-to podcast for ambitious individuals who want to live a more fulfilling life and a successful life, to get valuable insights and expert tips, inspiring stories to help you improve your lifestyle, grow your business, enhance your emotional well-being. So in every episode, you're going to gain practical tips, insightful wisdom in the company of a supportive community whom I call Sheila's Thrive Tribe, because all of our subscribers and listeners, listen, we're all about thriving. And listen, I know you are too. So you need to go ahead and subscribe if you have not, and call Mom and them and tell them that the Sheila C Hill Show is on, because listen, we love it over here. Listen, but however, if you are new to the show, welcome to the Sheila C Hill Show. I am your host, Sheila C Hill, and just hello, hola, bonjour, como está, ni hao, howdy, and what's going on, my people? Welcome. Hit that subscribe button, and so you can keep in contact with all this goodness that we have over here. And I tell you all the time that we have the best guests in the land, and today is not going to disappoint you again. I love it. I love it when we have super dope guests on the show. In this episode, we are so honored to host the esteemed Dr. E, who, listen, her name is synonymous with excellence and innovation in the healthcare analytics and operations, with over 2 decades of experience. She has been at the forefront of pioneering real-world data solutions crucial for advancing healthcare, drug development, and commercialization. Her exceptional leadership skills have been instrumental in cultivating high-performing teams and consistently delivering innovative solutions through her career. Now, listen, it just doesn't start there. Beyond her professional accomplishments, she's also a highly sought after speaker. What? In industry conferences and major events. Listen, she is your go-to girl, let me tell you. She's also been featured in various renowned magazines. She's been in so many different publications. Woo! She's busy. I thought I was busy. She's busy. She's also an author, a best-selling author. Listen, the list goes on. I could keep talking about all of her accomplishments. These are just a few. I mean, she's dedicated to mentoring women. So she's not just reaching there. She's also helping other ladies. She's mentoring them in healthcare at... Listen, we're just going to bring her on because, listen, I'm going to take up all the time. Just at this time, please put your hands together and welcome Dr. E to the stage. Welcome. Listen, we would have been going on and on about this with this bio that you have so many accomplishments. But without further ado, if you could introduce yourself to the people and tell us where you're from.
Absolutely. But first of all, thank you so much, Sheila, for having me. Such an honor to be here and share my story with the listeners, viewers, and everyone in between. My name is Dr. Ewa Kleczyk, and I am a healthcare operations and analytics executive for a biotech healthcare organization. And I have the privilege of working with data and creating solutions that can help us with solving the very important issues of healthcare access, diagnostic procedures, and timely delivery of treatments. I also have the opportunity and the blessing not to only be a woman in healthcare and STEM, but also bring on the new generation of women. That's very important for all of us who are in the industry, who are in STEM, and overall to share our knowledge and leave the ladder behind. So hopefully during the show, I can share a little bit some of my stories, but I really appreciate the opportunity. First of all, I live outside of Philadelphia. So it's the city of brotherly love, which I really, really love. The city is wonderful. And I am originally from Poland. So for anyone listening in Poland, dzień dobry, dobry wieczór. Bardzo miło być tutaj.
Ooh, okay. I love it. And tell them to watch the Sheila C Hill Show too. Say that in that language.
Sure. Proszę znaleźć Sheilę i jej program i subskrybuj, żebyś mógł
Woohoo!
i oglądać na żywo. Dziękuję.
I love it. I love it. I love it. Okay, let's get into it. Let's get into it. All right. First of all, listen, to be in this industry, which it is a male dominated industry. So I know there's been many challenges that you can share at your leisure, but can you share some key advancements in the healthcare that you witnessed over your 2 decades career and how they shape the industry?
Absolutely. First of all, the use of data. When I started, most of the data was through primary market research, doing surveys of healthcare professionals, patients, and deriving information from that. That arena is still here, but we have a lot of data coming from healthcare systems that allow us to really understand what patients, physicians, and clinics are facing. How are they treating patients? Where are the barriers for treatment, for access to care, as well as for speedy diagnostic process? So it's really helped us move us along. Second of all, at the beginning when I joined the industry, we were talking about arenas of treatment such as allergy, metabolic, cardiovascular, which are still very important. But oncology was much further away from breakthrough aspects, from breakthrough drugs coming online. Now they are here. Many women, especially with breast cancer, if they're diagnosed early, can have a normal quality of life post-treatment. Many other cancers have really evolved from the diagnostics and treatment patterns and being able to quickly diagnose and decipher the right treatment. And finally, what I would say is, before, in 10, 20 years ago, we never talked about rare diseases. We heard about patients struggling with something that we didn't understand, didn't know, but now we are more likely to treat diseases that are only impacting 1,000 patients, couple hundred patients. So we are definitely moving forward and having the medicine provide us with the opportunity to give quality of life, or at least manageable life for those who really need it and otherwise would have not had it.
Most definitely. I love that, especially the quality of life. My mother was recently diagnosed with breast cancer, and she just went through it and did the treatment. She's now cancer free, but that whole process of it is devastating just to get that diagnosis and then to not. A lot of times in certain communities, you don't get all the information or have access to the information that's needed. So this is a very important subject to talk about because listen, it's tough out here. It's tough. And a lot of people, they go without the knowledge, and it's not a good thing. But so I love the fact that you're touching on it, and you're not. A lot of times when you talk to people, or when I talk to people in the healthcare industry, it's more high level, and it's not really getting the analytics and learning like the people that is for. So that's very important piece of it, because whew, I can go on and on because I know, I've been there, I understand. So, as a pioneer in the healthcare industry, the technology and the innovation, could you discuss how some of the cutting edge developments and their impact on improving patient care?
Absolutely. So if you think about all of the technology, for example, machine learning, we hear a lot about AI, generative AI, that helps us with understanding images, for example. How are we going to be deciphering the minimal changes, let's say, in your brain, how your tumors are growing? So it's really revolutionizing, allowing us to really uh, understand the small changes and bring the right diagnosis much faster. Second of all, if we are thinking about the capabilities for testing, many tests technically were available, but there wasn't really a good way to analyze the data and get it in a fast enough manner to provide the right treatment. So with the increase in applications and the technological advancement for testing, now we can really much faster bring in the right diagnosed patients. So the procedure for diagnostics has improved, but more importantly, now with all of the information, whether they are biomarkers or any other components, DNA sequencing and all of that, we are able to decipher treatments that are specific for that individual. So we are going into what's called the precision medicine, where everyone now is treated as a separate self and be able to really get the targeted therapy, which can help them move in their treatment process and give them to the place where they need to be at the end.
Oh, I love that. The individual. I love that. Instead of putting everybody in one category,
Mm-hmm.
you're working with them individually. Oh, I love that. Thank you. Oh my goodness. I'm loving this. I'm loving all this knowledge you have, Dr. E. Woo! Okay, so you have your leadership and your experience in the healthcare industry. It's extensive, I know, and I can tell you love what you do by how you're talking so passionate about it. But what lessons or insights can you offer to inspire others looking to excel in similar roles?
So first of all, I would say is be authentic self. I think we've been all discussing that, but this is very important.
Yeah.
If you are not speaking your language, if you are not finding the communication patterns that you prefer, or you're presenting yourself the way you are, you will never be able to succeed, because it's not going to come in genuine, and it has to really come in. Second of all, I always say is find what you love. I know this is a cliche, everyone says it, but life is very long. Someone recently told me that many of us are going to be living 4 generations. Think about it, 4 generations. That means is that we have a long time to impact this world in a very profound manner. And over time, that drive or that the goals might be changing, but always find something that you not only that you have to do, but something that you really like, and leverage your experiences and your skill sets to help whatever that cause is, and move you forward. The next thing is be okay where you are in your life. Most people want to say, well, by the time I age 25, I want to this and this and this. Again, we all are going to be living through 3 to 4 generations, and maybe even more if we are lucky. And so it's okay to have a certain stage where you are focusing on your family, you are focusing on yourself, you are focusing on your community, and I think bringing all of that together, that creates a really interesting and powerful way of living, but also success, whether it's your professional life or your personal life. And then finally, I would say is always ask for what you want. Not only know what you want, but also ask for it. Very often, you see, especially for women, we don't ask for what we want. We are assuming that someone else will know what it is that's important to us. Well, no one has that capability to read our minds. So we have to overcome the aspect of not feeling like, oh, if I ask for something, they'll probably think that I'm trying too hard or I'm brown nose or whatever that may be. No, ask for it. Prepare for that question, prepare yourself for it, and do this. And finally, I want to say one thing. Most women never advertise themselves, and that comes to me. We have to do this. Your show is a perfect venue for this. Do it in a way that you can share your story, because we all come in from very diverse backgrounds, and everyone's story is important, and everyone's story can impact someone else, and we don't even realize how powerful it is.
Most definitely. I love it. It's like girl power all the way. Because listen, a lot of times I know in my culture, we have been conditioned to not toot your own horn, not brag. That's not becoming to brag. And it's just like, wait a minute, I'm not bragging, but I'm letting you know what I have to offer. So a lot of people shy away from that because they don't want to sound boastful or prideful. But listen, baby, shine like a diamond.
Absolutely, absolutely. And I think we need to remind all of women, especially, and anyone who feels that they don't have the platform for it, find that platform for it and do it. There is, especially with social media and technological advancements, we all can be our own star in the way we want to be.
Most definitely. Most definitely. So, my question is, how did you get into this industry?
So it was somewhat planned for, but somewhat not, more of a accidental. When I was looking how my grandparents, especially my grandmother, she died when I was 4 years old. She had RA, and at that time RA was pretty much a death sentence. So I remember seeing her on a bed without a bed rest continuously without being able to move. And that stuck in my mind. And when I was doing my PhD and learned econometrics, I had the opportunity to learn a little bit more about where analytics can be leveraged. And I realized that there's a growing need for analyzing data, healthcare data. And that's brand new. At that time especially was brand new to the arena, whether it's pharmaceuticals or healthcare. And by applying to different organizations, I had the chance to join one outside of Philadelphia and learn and realize that even though we are looking at the data, we are not in front of the patients treating them. Our impact is as significant. And by analyzing the data, understanding how patients are treated, what their comorbid conditions are, what are the pathways for understanding the drugs, approving the drugs, and what are the policies that our governments need to provide to give equal access to everyone. That when I realized that I have as much of an impact as someone who is frontline, and I celebrate everyone doing that. But there is a place for all of us with analytical skill sets and applying our skills to benefit not only patients but entire communities, helping all of the health systems to understand how to look at their data and make the right decisions, informed right decisions at the right time.
I love it. I love it so much. Oh, so much knowledge. Listen, listeners, y'all better be thanking me because listen, she's on this show for you guys, okay? So if I didn't have a show, then you wouldn't know this on this platform. I am loving it because it's so empowering to understand, and I know you empower women as well, but we're going to talk about that, your empowerment of how you're really helping other ladies in this industry after this commercial break. So we're going to be right back. I'm going to put you backstage and we're going to come with so much more. I love this conversation. Are you feeling overwhelmed with projects to build your business? Search no more. Introducing Borrow My VA, a virtual assistant service, your one-stop solution to bid farewell to stress and manage multiple tasks with very little effort. We specialize in website building, funnel creation, automations, and email marketing, all under one roof. And here's the best part. We provide all these incredible services at budget-friendly rates. Discover a hassle-free way to handle your projects. No more worries about onboarding or finding that perfect virtual assistant. Our team is all set to tackle your task with efficiency. Now, once you delegate the task, consider it done. Say goodbye to overwhelm. Don't miss this fantastic opportunity to elevate your business. Join our list of satisfied customers and book a free consultation today at borrowmyva.com. That's borrowmyva.com. Thank you to borrowmyva.com for sponsoring this episode. And if you would like to sponsor an episode on the Sheila C Hill Show, just reach out to us on the Sheila C Hill Show. .com. And you can do that, or you can purchase ads for our commercial, for our spots as well. So in the meantime, we're going to get back to the conversation with Dr. E, and we're talking about the healthcare and all the dynamics, and there's so many layers in the healthcare and the analytics that goes into it. But because you are in a male-dominated field, in the STEM field, empowering women, I know that's really extremely important to let people see, like, hey, you see me, I'm here, I've done it, I paved the way. But also you want to empower them in the technology. I know that's a commitment to you, but how do you envision creating diversity and inclusion in the tech sector, especially fields like the healthcare analytics?
Well, first of all, if we don't do this, we're going to have biases in our data. We're going to have biases in our analysis, right? So inclusion helps us with bringing in the perspective that is required. Second of all, I think it's up to us, for those who are in the leadership positions, to leave the ladder behind and bring others in. Why am I on these shows? Why do I go to conferences and talk about it? Because it is important to raise awareness. Very often young women do not know what they can do with analytics. They have no idea how important these aspects are. So it is up to, you know, myself and others who are very passionate around it, not to only close down the pathway for advancement once we get to the next level, but bring others along and recognizes that the more women, the more underrepresented groups are at the table, the better the services are, but also the better understanding of the data is, the better understanding of the solutions will be, and then ultimately the application and the execution of them. We all talk about equitable healthcare. It starts with also understanding what it needs to take in order to provide it and have those perspectives. You hear more and more the representation that each of the groups should be represented, that should have physicians who look like them, because that is important. That is important to understanding someone's background, to understanding someone's potential issues related to healthcare. Not everyone is the same. For me, for example, coming from Eastern Europe, we have a much higher cholesterol naturally. So if you don't understand Eastern Europeans, you might think there is something wrong with someone from my background. The same is with when we're talking about dermatology. African American community is struggling, has a very high rates of skin cancer rates, and ultimately having issues with treatment of that. That's because most of the physicians have a harder time diagnosing, but it's also not talked about it. And I think by bringing in and encouraging the diversity, whatever levels that might be, is very important. The next thing I would say is it's very important for all of us to, if we cannot find, if we don't see a seat at the table, create our own table, change the narrative, change the perspective, sit in a corner in that boardroom, bring your own lawn chairs, I always like to say, because the more you do this, the more others are going to be changing. You know, if you think about it, why so many male executives now are supporting a lot of women, young women, because they have daughters, right? They are realizing what their daughters, who are very smart and very capable and very driven, what are they going to be going into? And I think that changes that, having those advocates who understand the impact of not doing this. And finally, always remembering, innovation cannot happen without citation. Citation cannot happen without different and diverse perspective. So we should always ensure that we advocate to bring someone else into the room, because the discussion will be better, the insights will be more, better, more insightful, and the innovation is gonna be that much more pronounced as a result of the diverse group of individuals at the table.
Wow, I love it. I love it. And it is so commendable that you have this dedication to improving the healthcare access and educating them, and enhances the patient's quality of life. Can you elaborate on specific initiatives or strategies you found effective in achieving your goals?
Absolutely. For me, it's being involved in a local community. Where my husband and I live in outside of Philadelphia, we got engaged into community work in the Bangor local area. I went to University of Maine. My husband went there, and he is from that area. That's a very rural area where there is not often the amount of support and knowledge that is usually required. So we are part of a group for cancer, as well as we are also part of the advisory board for the college, just to bring a different perspective, to leverage our expertise and what we are experiencing in our professional lives, as well as living in a more affluent area, and bringing those experiences in to help advance the local community. So what I would say is, find somewhere where you can take your expertise and apply it for the betterment of others, because I don't think you're gonna be as successful if you don't have a passion for also going outside. I think many executives will tell you that it's one thing is to be always at home or always at work and moving up, but being able to be part of a community and supporting and leveraging what you know the best to support others is probably the most rewarding and influential aspect of all of our executive work. And no one is asking me to do that. This is doing it because that's what makes me realize how important it is to share my expertise and help others and help more disadvantaged areas and communities to get to the betterment and get to the levels that they require to support, whether they are patients, whether they get students, the right funding, whatever that might be. And I think would be one of those aspects. The second thing I would say is write up what you want to do and then figure out, break it down to the levels that it is important for every single aspect of how you want to accomplish. Nothing happens without a plan. And I know this sounds like, well, I don't want to have a plan. Everyone talks about it. Well, if you don't break it down, that goal might be so large that you will never accomplish that. Mm-hmm. But if you break it down to much smaller pieces, even if only in a year you only do one piece, one step, that's much closer to your goal that you were a year earlier. And always moving forward and always saying, okay, I fell down today, but I'm gonna, come up tomorrow. It's okay. We're all human, and also understanding that we are all human. We all will be sick. We all will have some other things happening, but enjoying the life in a way that is fulfilling to all of us, and enjoying the ride, because the ride is pretty long for most of us.
Yes, it is. But we need to enjoy it where we are in this moment and understand, like you said, we're human. Get up. One of my girlfriends, she has a saying, you have 5 minutes to sit in your stuff, and then you get up and make things work, right? Instead of just having a pity party. Woe is me, I did this wrong. No, it's okay. Get back up and get it going. Listen, I love it. I love it. Now, US had some stats about Europeans and the different things. And so knowing like the international piece of it. So with your international background, how does your global perspective influence your approach to health care analytics? And what does it contribute to the richness of discussion in the field?
Great question. Having the other perspective, having a little bit broader perspective, first of all, I've lived in a social healthcare environment. So that gives us, there's a lot of debate about what should we do, how we should be doing this and so forth. And I think that is important to understand that what are the benefits, clearly, for example, from national healthcare, everyone has access to the basics. And then what are the other drawbacks? Are you waiting in line to get something or not? On the other hand, private healthcare system as we have in the United States with some government support, especially Obamacare, helping move some, providing that access to the underrepresented groups and the low-income individuals. It's playing in and providing other opportunities. Which one is better? That really depends. That really is what are the priorities. Clearly, in Europe, you will have a certain way of doing treating patients. But there is also a big line sometimes. My mother, for example, had to wait a year to get in to see an orthopedist. Well, if you can wait, that's okay. If you can't, you still have to then go into a private system to get the same visit done. So I think there is a component of this that you always have to be evaluating. Second of all, outside of the healthcare system discussion on what it should be and what is best, there is also the understanding that we are all very different. I think we have heard that FDA put in discussion about the diversity in clinical trials, because very often drugs were tested on a very similar population, whether it's by race, by gender, whether it's on country of origin, whatever that might be, or lifestyle. It is important to bring in the other, the representation overall, because how do you know that that drug is the right drug for someone coming from Africa, or Eastern Europe, or coming from Asia, whatever that might be, because you do not know how your genetic makeup might be impacting the actual efficacy of the drug overall. So that awareness, I think, is coming in. That is what helped me understanding, and also understanding why sometimes the results might be different, why you might be seeing different way of treating patients. And I think with the advancements of technology and the knowledge and understanding, especially in the United States, We are a very diverse country, this is a powerful statement to this country, and um, uh, allowing for everyone to be here. And it allows us to also then ensure that we understand the differences and account for them when we are doing research, testing drugs, and then ultimately providing the right care, so everyone can get the right care or the focused care that they require based on what their genetic makeup is, but also what is their heritage, whatever that may be reflected by.
Wow. Okay. So as listen, you just you have so much knowledge. But someone with your health, and I know this is the last question, as someone with the wealth of knowledge, leadership experience, and commitment to advocacy, what advice do you have for individuals aspiring to make a positive impact in the healthcare landscape?
First of all, get your education. That's always good. Understand
Okay.
what you need to do, and know whether you want to be in the you want to be the front line. We always need nurses. We always need physicians, and I want to applaud them because we don't talk about them as the heroes. But there is also
Yes.
a different way. You can be a recruiter for a hospital. You can support. You can be lab technician, or you can go into what I did, and which is help with work in healthcare, in consulting, operations analytics area, where you are in the back helping the right decisions to be made with looking at the data and applying the right technologies to get the insights from the data in a timely manner. So I would say is understand where you want to be. There is no right or wrong way. Second of all, figure out it's what it is that you want to be passionate about. Do you just want to be working, or do you want to have something else that you want to be doing? If you want to be in a community setting, do that. There's plenty of patient advocacy arenas. There's plenty of nonprofits that are requiring and needing individuals who are very passionate about healthcare and bringing the right cure to the needed patients. So think about that also. Is it corporate area? Is it the healthcare system? Or is it a nonprofit and patient advocacy? Where you want to be, not the right or wrong answer. Or is it in academia? We don't talk about medical schools here, but medical schools are important. And
Yeah.
government agencies are extremely important. So there's a lot of different places. And for those of you going in, I would say is help the young people as well, because it is becoming very crowded as you go up the ladder. Let's be honest, and the level of um, competition is much harder and much greater. But you cannot go up in your profession. You cannot go up and advance if you don't mentor others and create the succession line. We all have to have succession line, because at
Yes.
some point we will retire, but also at some point we want to do something different. If you don't have people succeeding you, and they can do your job better than you do, because that's ultimately what you want, and can be successful, well, then you have really failed as a leader, especially. But also you haven't advanced the arena, because the arena is advancing when we share our knowledge and allowing others to build on that knowledge and take us further, because our understanding is different than someone coming behind us who are not exposed or biased with the upbringing in the different eras
Yes.
that some of us have been coming from. So I would say is it's I understand that what you want to do, figure out how, get the right education for it, and then help others, keep mentoring, and not only going to help you, but it's going to help others to get into that arena.
Most definitely. It's going to help my daughter because my I was taking my daughter to school today and I said, "Okay, what do you want?" She's in 12th grade. What do you want to do? Cuz there it changes almost every time I ask her. And she's, "Well, mom, I told you I want to do like business administration, concentration in healthcare, and I want to work in the hospital and help with the policies and the different things." And I was like, "Really?" She said, "I've always wanted to do that." I was like, I've never heard of that. But anyway, she's been doing her research. So I cannot wait for her to listen to this interview because it can give her some direction. And this is what she says she wants to do. I'm so excited. Oh my God, I'm so excited.
Wonderful.
Okay. So thank you for your knowledge. Listen, I know we have to go. We have to go. Oh my God, you have so much. How can people get in contact with you? How do they get in contact with you? You're on social media, you have a website.
Yes, they can go to my Facebook page, Ewa Kleczyk. So you can see my name on the screen there. You can do that. You can go to my Instagram page, is Dr. Ewa Kleczyk. They can find me there as well as on LinkedIn, Ewa Kleczyk as well. So if anyone would like to connect with me, please do. I'm always happy to do that. Always happy to share any knowledge and stay in touch.
Awesome, awesome. And we have all of her contact information in the show notes. So you can just click on it and follow her for more information, more knowledge, empowerment. Also to book her for speaking. Hey, listen, you see she's available. She's super dope. So please go ahead and book her for your next event to empower ladies, to empower in the industry, to show so much. Listen, there's so many ways that you can book her. So go ahead and book her today. And also, as we close out, what is something that you want to share, Lee, with the audience? Anything inspiration or anything that you just want to share?
Since we are in a Women's History Month, I would like to just say to all of the young women that are here, or those who are in their prime and they are or later in their life and still figuring out what they want to do, don't be worried about not sitting at the table. What I would say is, if you don't find the table that is fitting you, create your own table. Pivot, create your own table. There is so many opportunities that we can all do, and create the tables that fit women or that fit underrepresented groups or fit whatever issue that you are trying to solve. And once you create a table, be open. Invite others to the table and cherish their perspective, because we all can be only better and we can only advance and do innovation if we are all respecting and hearing each other and taking the right points and moving us along. So thank you.
I love it. I love it. Thank you for being an awesome guest on the show today. I really appreciate it. I'm going to take you backstage and I'm going to close out. Listen, that was awesome. Wonderful. So much advice. That was so many gems, guys. And the level that she gave it, listen, you need to really connect with her because she has a heart. I can tell she has a heart to serve people, to empower as well. So do that. Don't do nothing else. Go ahead and follow her right now on the social media platforms. So in the meantime, you guys, another show in the books. I love it. I love it. At the end of the day, be authentic. She said that from the very beginning. Be who you are. Stand up for yourself. If there's not a table with your name on it, get your own table. Right. Listen, get in that room. If you have to bring your folding chair or your picnic chair, get in the room. But when you're in the room, and I always tell you all this, when you're in the room, make sure they know you in that room, baby. Listen, make sure they know you. Like, who is she? So shine bright like a diamond, the way that you are. So in the meantime, listen, guys, if no one has told you today that you are loved and are highly appreciated, I am telling you now, you are loved and highly appreciated, and your life is worth living. And we need you to walk in your purpose. We need you to shine your light. So it's time to go. Let's get it. Let's go. Until next time on the Sheila C Hill Show. Love.
Hello, everyone. My name is Dr. Ewa Kleczyk, and welcome to Sheila C Hill Show. Okay, one more time. Hello, everyone. This is Dr. Ewa Kleczyk. Please join us in Sheila C Show. One more time. I apologize. I need to do it one more time. I have to do it one more time. Sheila C Hill Show. Okay. Hello, everyone. My name is Dr. Ewa Kleczyk. Join us for a special episode of the Sheila C Hill Show. Thank you.
Awesome. Everybody always get that C mixed up. They were like, Sheila C. But it's okay. Okay, so next, you're going to say basically the same thing, but you're just going to say, how was your experience on the Sheila C Hill Show?
Okay.
All right, so you're going to introduce yourself and go.
Hello, everyone. My name is Dr. Ewa Kleczyk, and it was such a pleasure being a guest on the Sheila C Hill Show. I highly recommend it, and I hope you're going to join us and join her in the future episodes.
Woo, woo, first take. Awesome. Thank you very much. And what we will do is once my team finishes it up, we're going to have the show. We'll let you know. We'll send you an email when the show will
Okay.
air. It will probably be the beginning of next week, about maybe Tuesday.
Okay.
And then we'll send you the artwork that goes with it and then the link. And then you can share the link with your community and your followers as well.
Fabulous. Thank you so much. Really appreciate, Sheila. So nice meeting you, and what a great show you have. So I look forward to the airing of this. So thank you.
Awesome. It was a pleasure meeting you too. All right. Have a blessed day.
Thank you. Bye-bye.
Bye-bye.